Let's get analysis on the upcoming changes in the U.S. healthcare coverage and how it is likely to affect businesses and consumers alike. Ryan Tate is the founder and president of Tate Publishing and Enterprises, named one of the best places to work in Oklahoma in 2008, and he joins me now live from Oklahoma City. Ryan, thanks so much. This is a complicated law, so complicated, in fact, that Congress's nonpartisan think tank, the CRS, says the administration has failed to meet half of the 82 deadlines of the Affordable Care Act mandates. Okay. Now, if the administration's having all sorts of problems with this new law, how about business owners like yourself? How cumbersome is it going to be?
Sure. Well, I think when you look at the facts and you see that they're having trouble meeting their own deadlines, Mike, really that means this is something that's not ready for showtime yet. It means they're still working out the kinks. For business owners like myself and owners all across America, we've been struggling to get good information about it. The facts change every day. The deadlines change every day. Myself, I faced a 32% increase in our health insurance premiums for this upcoming renewal alone, and we were all hoping for a better opportunity to save some money.
So what does that mean for your business?
Well, for us, you look for as many different options as you can find, self-funding options. In the state of Oklahoma, we rejected the exchanges, so we're even a little further behind states that have welcomed the exchanges in. We don't know what they look like. We don't know what the policies look like. We don't know how much they cost. Business owners are lost, and I've spent tens of thousands of dollars with experts, analysts, trying to help us navigate what to expect. And for us, we had to increase deductibles, decrease, the amount of benefits in our insurance policies, just to be able to still afford offering health care to our employees and their families.
You know, that's a common complaint of this law, is that it is a moving target. New regulations still being added, as you mentioned, and the head of one state's health exchange has even said, sometimes it feels like we're driving a car and then changing the tire at the same time. It sounds to me like you'd agree.
Oh, that's the exact feeling that I think I personally have, but that business owners all across America have. At the end of the day, we just want to know what it looks like. We want to know what we're up against, and we want to make good business decisions. But when the variables are constantly changing on us and the administration is continually trying to figure out exactly how to implement their own policies, it makes for a very fearful market and an unknown chart for business owners like myself.
Ryan, we're spending a lot of time talking about businesses like yours and complying with the new law, trying to deal with it, trying to understand it. But what about consumers? Has the government made it easy for Americans to learn about this new law and how they can benefit from it?
Sure. I know they're trying to reach out and they're trying to educate the individuals about what's out there in the marketplace. I don't think they've done a very good job. I talked to those same people, and there's just a lot of confusion on both sides with what to expect. I know everybody wants affordable health care, and everybody wants the best coverage possible at the cheapest price. So they're up against it. That's a difficult thing to offer. My concern, though, is the scope of what they're trying to roll out, the amount of uncertainty that they've created and put into the marketplace for individuals, businesses, consumers alone. I mean, look at what uncertainty does to Wall Street, Mike. It's not any different for other businesses that have, P&L statements they have to manage.
That's true, Ryan, but let's face it, a lot of our viewers around the world would look at this and say 50 million people in the United States uninsured. That's staggering to many of them because this is the richest economy in the world. So with all the challenges, it still would appear to a lot of people around the world that this is a step in the right direction. How would you respond to that?
Sure. I get asked that question a lot. Now, the last reports that I looked at said that even with the full implementation of the Affordable Care Act, there's a potential that almost 30 million Americans will still be without health coverage. So that doesn't fix the problem overall. Do I think providing health care is a good idea? Sure. My challenge is that I'm not sure the government can do it. I think there are a lot of things we could have done and could do to the current system, like opening up competition across state lines for these private health insurance providers that would drive down costs and open up coverage. I think there are a lot of elements and issues that private insurance providers have done that are horrible, like not covering everybody in certain cases, and I think they've really pushed to make sure they're making the most amount of money. So there are good parts to the Affordable Care Act. There are parts that I think are still up in the air. I think it's a step in the right direction to try. I'm just not so sure that this is the way that can happen. And that's what concerns me with the changes they're making, and that it obviously not being ready for prime time. You wouldn't push these things back if you were ready for it. So Ryan, that's my concern.
Ryan, let me just interrupt for just a second, because I want to get your thoughts on this, and we only have about 20 seconds. You know, the administration has given a reprieve for businesses until 2014 to implement this law. Is that enough time for you?
You know, I don't think so, not with the changes they're making. You know, every time they make a change, the clock starts over. I don't want them to postpone the inevitable. We want to know what the rules are. We want to know what the game is. We want to know what the situation looks like. And then as business owners, we want to make good business decisions for our employees, for their families, and for, you know, what is cost effective for us.
All right,
and
Ryan,
at the end of the day,
Ryan,
that's how we stay open.
I'm sorry, Ryan, we're going to have to leave it there. Thanks so much for joining us. Ryan Tate, live in Oklahoma City with us this evening. Thank you.